Welcome back and thank you for joining us again. And please subscribe to our YouTube channel. We're also on Instagram and TikTok and Vumedi if you're a physician anywhere in the world. We're going to be talking about scoliosis today, and we have Dr. Mary here. Thank you for being here, Dr. Mary. And Dr. David. Take it away, Dr. David. Thank you.
All right. We're going to be talking about scoliosis. I'll break down the words so that we'll have a good understanding of what it means. So it comes from the Greek word scolios, which means bent or crooked. And then cis is more like a condition. So that what it means, transliterating it means bent condition of crookedness.
That's important because a lot of our textbooks were written by the Greeks.
Yes.
Especially in medicine, and so Latin.
Yeah.
Right? Latin is Roman or Greek?
Yes.
Latin is Roman.
Roman.
Greek is different.
Yeah, okay. And it started with the Greeks. Yeah, but it's very important to know because that gives an idea of what exactly you're describing.
Yeah.
Sorry.
So in this condition, there's a lateral curvature of the spine. So usually when you see people that have it, sometimes it's not very obvious, but then in very obvious cases, you see a slight bend in the curvature of the spine. So it's more like an S shape kind of. So
I tend to call it side bending because kyphosis is forward bending.
Yeah.
Like your hunchback.
Like I say, it's a side-to-side curvature of the spine, which can give us a C or an S shape of the spine.
Exactly.
All right.
So usually it's measured with an angle. There's an angle called the corpse angle, usually seen on X-ray. The condition is characterized when there is more than 10 degrees bend or 10 degrees curvature in the spine. So once that is identified, you're down with the condition of scoliosis.
So you have different levels. There's mild.
Yeah, there are different levels. It could be mild, it could be moderate, it could be severe. And there are different types as well. The most common type is the adolescent idiopathic scoliosis, which represents about 80%. In Nigeria, the data is not very clear, but about 2 to 3% of the population has that. In the US, it's also about 2 to 3%.
Okay.
Around 6 million of the population have that in the US. It's common in girls. It's more common in girls than boys.
I agree. I agree.
And females would require 8 times more likely to get treatment, to require treatment than boys as well.
Boys.
Yes. So that's basically a brief overview of scoliosis. Talking about
okay.
Yeah.
So generally in the US, we have that, we have like the screening scoliosis as part of the physical for children, especially when they're like 9, 10, going through adolescence, when they've had that growth spurt. And a lot of parents ask, so why? What is the reason why children get scoliosis? And like you said, it's idiopathic. There's really no reason. But I think from my own experiences, a child is growing and growing very fast. Sometimes one part of the spine can grow very fast and then eventually compensates. So I usually tell parents, depending on the degree, we send them for x-rays to get the degree of scoliosis, especially we just have children bend over and kind of like try and touch their toes.
Their toes, they see the curvature.
Exactly.
Adam's bend test.
Yes. And when we notice there's scoliosis, depending on how severe, we usually do x-rays and just to get an idea. And if they have more than 10 degrees curb on their x-rays, because it's an x-ray diagnosis, there's a clinical diagnosis and x-ray diagnosis, then we send them to orthopedics if it's severe. But if it's mild, then we can watch and do serial x-rays every year. But why should we worry about scoliosis, and what are the other causes of scoliosis apart from the idiopathic?
Okay, so we have the congenital.
Okay.
So this is usually caused by improper development of the vertebrae.
Improper what?
The vertebra is not properly developed in utero while the child is still in the womb. So that's congenital. So they are born with that defect. Then the idiopathic, which usually starts around adolescence. No known cause, basically. Then we have the neuromuscular, neurodegenerative, which is caused by certain conditions like,
muscular dystrophy.
Muscular dystrophy.
So Duchenne's muscular dystrophy. Yeah, and those are genetic. Those are genetically acquired. Yeah.
And in some cases of severe perinatal asphyxia, they can also have scoliosis because some of them develop into cerebral palsy.
Exactly.
And that is a disorder of motor and function. So you can see that their curve is there because there's muscle weakness, muscle spasms. So that can't coordinate the spine. So subsequently, they have scoliosis.
And then they need to have back surgery.
Yeah, so
depending on how.
depending on how bad it is, they can have low back pain, limb leg.
See, you're thinking of neurology and
I'm a neurologist, so you have the low back pain, leg discrepancies, shoulder discrepancies, and prominent shoulder scapula because of the disparities. So in most cases, we request for a CT scan or MRI, involve the neurosurgeon as well. It's a multidisciplinary approach. Then the physiotherapist, the occupational therapist. Some of them will have braces.
Yes.
In some cases,
Those braces.
Yes.
I've seen people wear those braces and they don't like it.
No, it's not funny at all. Then they are also on pain relief because some of them have back pain or leg pain. So they're on serial pain relief. And we continue with physiotherapy together with the brace, and that has helped most of them. Yeah.
In the past, people used to do surgery. I know.
They still do surgery.
But that surgery, it was like a big rod going through the back. I've seen X-rays of our patients that had. But I think with time, it's not as. I think it's not as it's not as intense as it used to be.
Yes,
because those rods were like big rods
going into your spine.
Yes, you could feel it in the patient.
And what has affected most of our patients now is cost of living. Because of the economic hardship, most of them are not seeking surgical intervention. They are just going for the physiotherapy
and for the brace.
Just to cope with life. I think if the economy was much better, they may have. So,
well, in the US, I think a lot of people are.
Yes.
US
has a health plan. Payment plan, but Nigeria, you pay out of pocket.
That's true.
Which is affecting some of our money.
Everything is relative. So depending on which part of the world you are. But I think they still do, if it's severe scoliosis, they will try the braces first.
Yes.
And then if that doesn't work, then they go on to do
surgical intervention.
Yes. And the spinal surgeons, they are pretty good at doing that.
Also, the degree of the angle also influences treatment. So the extent of the curvature. Usually, if it's less than 25 degrees, they do watchful waiting.
Okay.
So between 25 and 45, there's where they institute the use of braces.
Okay.
Then above 45 to 50 degrees and upwards, they do the surgical intervention. So they do it's called a spinal fusion.
Yes.
Yeah, so they do that. So that helps too.
And I know that back surgery, because it's nerve pain, it can be very, very painful.
Very painful.
But well, people have done it and they're happy with the results, so we're good. All right. So thank you, Dr. David. Thank you.
Thank you very much.
Thank you, Dr. David.
Thank you, everyone, for listening today. And if you have any questions, please go ahead and put it, subscribe, and then send your questions.
Please subscribe. Thank you.
Yes. All right. See you soon. Bye-bye.
Bye.